Hey guys, it is Friday, April the 9th. Let that sink in for a moment. April the 9th. So, a few things to update you on today. Most of it is around COVID or the vaccine or something like that. But I think many of y'all by now know that DHEC sent us a shipment of the Johnson& Johnson vaccine. Yay! The one-shot vaccine, and we are deploying it as fast as we can on the Mobies. We actually had an event over in Bishopville, and about 175 folks showed up for the vaccine, even including some of our own staff. So I know that many of y'all out there have been waiting on the one shot. This is the chance. We don't know if we'll be getting any other shipments of the Johnson& Johnson, so for now, this may be all we get. We'll just have to see. We have been approved, as I've told you before in the past, for the HRSA direct shipments, and we've requested Johnson& Johnson for that because we think it's time now to move toward that. But we frankly don't know what we'll get. So take advantage of this if you've been waiting on the one shot, or you have friends, family, neighbors, or what have you that have been waiting on the one shot. Well, now's the chance. It might be a very tiny window, so get out there and take advantage of it. I have asked that the Moby schedule be posted on the web page. It is a public calendar. We don't have the vaccine available for every single Moby because, frankly, we've got to staff it with someone who can be a vaccinator, which is either an LPN or other trained folks. And, well, frankly, just our nurses, LPNs or RNs. So that's why it's been kind of a slow rollout, only being able to roll a few Mobies with the vaccine on it. So take advantage of this if you can. It's the chance. Um, I also wanted to remind everyone, and this is really, really, really important. You know, we are providing the monoclonal antibody treatment, an IV, an infusion, at Hartselle, at our IV little suite over there. This is a very, very important thing. We are the only FQHC in South Carolina that is providing this. Now, what's really important about this, because hospitals also provide it, some other ambulatory offices that have IV infusion capabilities, even IV infusion centers, may be also providing it. But in our case, because we are an FQHC, we can provide this to someone who doesn't have insurance according to their ability to pay. So this is really important. Please remember that this is for folks that have tested positive, but they are in a window of 1 to 10 days since they have tested positive. And there are a few other little screening criteria. Things like, do they have a comorbidity like hypertension or diabetes or even obesity? Those things that qualified folks for the early vaccine. This is a game changer. It can prevent hospitalizations and death. We're seeing some extraordinarily good results in our own operation, but across the state, some very, very good reports. So please, if you know someone, if you yourself have tested positive and there are symptoms, you have symptoms, please step up and get that treatment. It can be a lifesaver. So our hats off over there to Hartselle, to Jennifer and her staff in IV and infusion. It's just an hour infusion. It's not a big deal. You do have to wait another hour to make sure that there are no side effects or anything, but then you're free to go. So spread the word on that. It's really, really important. Um, Many of y'all have probably heard in the news or from other sources that the American Rescue Act, as it is called, was passed by Congress. And in the American Rescue Act is an earmark for FQHCs specifically. We have gotten notice of that at Care South, and indeed all of the FQHCs have gotten a notice. We are in the process of compiling our budget for this. We have till the end of May to submit this to HRSA. And there are a lot of possibilities with this. We are really excited. I can't really announce anything specifically yet because we haven't done our work, but this is a right good bit of money. It is a public uh, notice, so you can go on the Bureau of Primary Healthcare webpage and actually see the amount of the grant that everyone got. In our case, for Care South Carolina, it was $7.7 million. Let that sink in for a minute. So we're working hard on this, your executive management team, because we don't have a lot of time. We've got to be telling HRSA what we're going to be using this money, like I said, no later than the end of May. I'm asking that folks really start scrambling around and figuring out, according to the guidelines, what we can do with it and what are the appropriate things that we can spend it on. But I can tell you that you're going to see some really incredible changes. We're very excited about some of the possibilities. On top of that, in May, there will be another round of grants that are devoted just specifically for infrastructure, capital infrastructure. Now, those are words that may not mean anything to many of y'all, but what that literally means is buildings. We have a huge need for the building in Latta. And we are so hoping, fingers crossed, and everything that this opportunity for this infrastructure grant, we don't know how much it's going to be yet or what, we just know that it's coming, will give us an opportunity to move forward with a new building in Latta because we desperately need it. We're tired of the septic tank not the septic tank, but the sewage backing up. Ew. We're tired of the roof leaking. It's time to get a really good building. So stay tuned for that. Speaking of buildings, if you're around the Dillon Way, you can drive by now and you can actually begin seeing some things are taking place. Foundations, girders are up, things like that. Things are underway in Dillon, and we're really, really excited about that. Remember, that building is going to look a lot like McCall. It's going to be bigger than Chesterfield. It's going to look a little bit more like McCall, but instead of like McCall has, if you're looking at the front of McCall, on the whole left side is the gymnasium and the rehab center. In the Dillon case, it's going to be the Department of Health and WIC services are going to be over there on that left-hand side. So lots to look forward. It's going to be a lot like McCall. You can kind of think about that. And when we build the building in Latta, it will be a lot like Chesterfield. We've got a model that works. We've got a model that's kind of our brand now, that we can almost plug and play. We know how to do it. We've got good contractors, good suppliers, and everything. So boy, these are going to be some pretty exciting times ahead of us over the next couple of years. Buildings and grants and lots of things happening. Um, my last thing that I want to bring up is, you know, when we rolled out the incentive and a few other things around immunizations and so forth, you can qualify for that if you can also prove immunity by having the antibody test. I know there's this word antibody that's floating around a lot, monoclonal antibodies and now the antibody test. But this is different. So This is a lab test that you'll get from our lab. It'll be sent off to LabCorp and will determine if in the past you've had COVID and antibodies as a result of having had COVID have developed. And those antibodies are giving you an immunity, so to speak. We've heard that there may be some confusion around whether or not PEBA, our public employees insurance, is paying for that. Don't worry. You will not have to pay anything. Even if there is a snafu and LabCorp bills you or anything happens, you let us know because we will pay for it and we will figure out what's gone wrong because PEBA, the Blue Cross Blue Shield Public Employees Benefits, said that they were going to pay for this. So who knows? It could be a coding mishap or their need for something to come across differently. But don't worry. Go ahead and get your antibody lab test and see if you've got antibodies. Don't wonder about it. See if you've got antibodies because if you got antibodies, you've got some immunity that has been built up. Now, let me remind you though that the CDC is recommending, even if you've got antibodies from having had COVID in the past, they're still recommending that you go ahead and get the COVID vaccine. There's some really good evidence that that doesn't do anything but help build up more antibodies. And there is a little bit of evidence that's coming up that is saying that it may even help with some of the long-term effects and impacts of COVID. You know, there's discussion around COVID long haulers whose symptoms, they may be mild or they may not be, that continue and go on and on and on. Those are what people are calling long haulers. And there even is a little bit of evidence that's cropping up now that's saying that the vaccine may have a little bit of help with that. So I really encourage you, get the antibody test if you've had COVID or think you've had COVID. If you end up with a lab bill or whatever, make sure you take it up to AR. They know about this, and we are not going to make you pay for it, even if we pay for it ourselves. That's basically about it. It's busy, busy, busy. Lots going on, lots of exciting things, like I said, from the American Rescue Act. And on top of everything, it's spring. So I know we all are glad to see that cold weather go away, although I just heard some news that it's going to be windy this weekend. Wow. But have a good weekend. Stay safe. Remember, the data looks really good now. The cases are going down. Death rate is going down. Hospitalizations are going down, but we are not out of the woods yet. So continue to wear your mask, practice safe, effective practices to keep you safe from COVID, safe from spreading it. And let's see where we end up in a few months and get this pandemic under control. And if you haven't had it, don't wait. Vaccinate. All right, y'all. Talk to you next week. Have a good week and a good weekend. Bye bye.